Welcome to my YouTube channel. Our today's topic for discussion is gastrointestinal pathophysiology. In today's discussion, we will review the diseases associated with gastrointestinal tract. Our first disease in today's topic is constipation. Signs and symptoms of constipation: passing fewer than 3 stools a week, lumpy or hard stools, straining to have a bowel movement, feeling as though there's a blockage in the rectum, cannot fully empty rectum, abdominal distension, abdominal pain. Complications include hemorrhoids, anal fissure, fecal impaction, rectal prolapse. Causes of constipation: blockages in the colon or rectum, anal fissure, bowel obstruction, colon cancer, bowel structure. Other abdominal cancers that press on the colon: rectal cancer. Rectocell, problems with the nerves around the colon and rectum, autonomic neuropathy. Multiple sclerosis, Parkinson's disease, spinal cord injury, stroke. Difficulty with the muscles involved in elimination, animus. Dyssynergia, weakened pelvic muscles, conditions that affect hormones in the body, diabetes. Hyperparathyroidism, pregnancy. Hypothyroidism. Risk factors for constipation: older adults, female. Dehydration, low-fiber diet, limited physical activity, medications, mental health conditions. Pathophysiology. Chronic constipation is infrequent bowel movement or difficulty passing of stool that can persist for several weeks or longer. Constipation is described as having fewer than 3 bowel movements. Prevention: high-fiber diet, drinking plenty of fluids. Diagnosis of constipation: blood tests, physical exam, imaging. Treatment of constipation include: increase fiber intake. Exercise most days of the week. Don't ignore the urge to have a bowel movement. Laxatives. Our second disease for today's discussion is inflammatory bowel disease, IBD. Pathophysiology includes: is an umbrella term used to describe disorders that involve chronic inflammation of the digestive tract. The main conditions are: ulcerative colitis is a condition which involves inflammation and ulcers along the superficial lining of the colon and rectum. Crohn's disease is inflammation of the digestive tract but can involve the deeper layers of the digestive tract. Signs and symptoms of IBD: diarrhea, fatigue, abdominal pain, abdominal cramping, blood in stool, reduced appetite, unintended weight loss. Complications include colon cancer, skin, IBAN joint inflammation, medication side effects, primary sclerosing cholangitis, blood clots, bowel obstruction, malnutrition, fistulas, anal fissure, toxic megacolon, perforated colon, severe dehydration. Cause include a stress, diet, immune response. Risk factors of IBD: nonsteroidal anti-inflammatory drugs, age, race, ethnicity, family history, smoking. Diagnosis for IBD: tests for anemia and infection. Stool studies, colonoscopy, sigmoidoscopy, endoscopy, imaging. Treatment for IBD: anti-inflammatory drugs, immune system suppressors, biologics, antibiotics, nutritional support, surgery. Our third disease for today's discussion is gastroesophageal reflux disease. Pathophysiology of gastroesophageal reflux disease occurs when the stomach acid flows back into the oesophagus. This acid reflux can irritate the lining of the oesophagus. Signs and symptoms: heartburn, chest pain, difficulty swallowing, regurgitation, sensation of a lump in the throat, chronic cough, laryngitis, new or worsening asthma, disrupted sleep. Risk factors of gastroesophageal reflux disease: obesity, hiatal hernia, pregnancy, connective tissue disorder, delayed stomach emptying, smoking, eating large meals, eating late at night, eating fatty or fried food, alcohol, coffee, NSAIDs, obesity. Hiatal hernia, pregnancy, connective tissue disorder, delayed stomach emptying, smoking. eating large meals, eating late at night, eating fatty or fried food, alcohol, coffee, NSAIDs. Complications include narrowing of the oesophagus, an open sore in the oesophagus, precancerous changes to the oesophagus, diagnosis of gastroesophageal reflux disease, symptoms and history, endoscopy, ambulatory acid probe test, oesophageal manometry, X-ray, symptoms and history, endoscopy, ambulatory acid probe test, oesophageal manometry, X-ray, treatment therapy, medication, surgery in worst case. Our last disease for today's discussion is diarrhea. Pathophysiology includes loose, watery, and potentially more frequent bowel movements. Most episodes are usually short-lived, however, if it lasts longer, it could be something more serious. There are four main mechanisms that cause diarrhea: increased osmotic load in the gut lumen, increased in secretions, inflammation of the intestinal lining, increased intestinal motility. Causes of diarrhea: viruses, bacteria, parasites. Some medications: lactose intolerance, fructose, artificial sweeteners, surgery. Digestive disorders, food poisoning. For understanding diarrhea, we must first understand dehydration. Dehydration signs in adults: excessive thirst, dry mouth or skin, little to no urination. Fatigue, dark-colored urine. Weakness, dizziness, or lightheadedness. Dehydration signs in children: not having a wet nappy. In 3 hours, dry mouth and tongue, fever above 39 C, drowsiness. Unresponsiveness or irritability, sunken appearance to the abdomen, eyes, or. Signs and symptoms of diarrhea include loose, watery stools, abdominal cramps, abdominal pain, fever, blood in the stool, mucus in the stool, bloating, nausea, urgent need to have a bowel movement. For cure of any disease, it's necessary to take care of prevention. So prevention includes preventing viral diarrhea. Wash hands frequently with soap or hand sanitizer if soap is not available. Preventing travelers' diarrhea: know what you eat, know what you drink, check travel warning. Preventing viral diarrhea: wash hands frequently with soap or hand sanitizer if soap is not available. Preventing travelers' diarrhea: know what you eat, know what you drink, check travel warning. Treatment of diarrhea: keep hydrated. Antibiotics if caused and fully diagnosed.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.